Good evening and thanks for joining us. I'm Sylvia Perez. Lately, there's been a lot of talk about vaccines. Parents are asking, could the traditional vaccine schedule change very soon? What about safety? Are our children getting too many vaccines or maybe the wrong ones? If you're feeling confused, you are not alone, and that's why we are here tonight for our special report, Vaccines Ask the Doctor. So joining me to discuss is Dr. Shika Jain with UI Health. We will be talking to Dr. Jain in just a minute, but first, let's take a look back at what's been happening. This issue exploded into the headlines in the past few weeks after Health Secretary Robert F. Kennedy Jr. fired all 17 members of the CDC's Advisory Committee on Immunization Practices and then brought in 8 new appointees.
Going to bring people onto the ACIP panel, not anti-vaxxers. We're bringing people on who are credentialed scientists, who are highly credentialed physicians.
And the new panel members are not wasting any time. Here's what's changed in the short time they've been in their positions. This new panel has begun reviewing and reevaluating the overall childhood vaccine schedule, has recommended flu shots, but only without a preservative called thimerosal. And Kennedy has scaled back COVID-19 vaccine guidance for healthy children and pregnant women. So let's get back to Dr. Jain to find out what she has to say about what's been going on. I just want to get your initial reaction to all of this.
So thanks for having me to talk about this really important topic. I am concerned, as are many members of the healthcare community. We have had decades of science, of vetted experts who've dedicated their lives to looking into vaccines, looking into the science, using evidence, making sure that the vaccine schedules we have for our children are safe and effective. And what's happening right now is those experts are being replaced by people who have not dedicated their life to looking at vaccines, who have not looked at the science. And it seems like many decisions are being made based on personal ideology, based on personal opinion, and not based on evidence, which is very concerning because not only does it sow a bunch of mistrust, it also is resulting in us questioning if the new guidelines that they're going to put out are going to be based in science or not.
And I want to say, I looked at the background of some of the panel members, and some have been some people have said some of them are anti-vaccine people, if you will, and that some of them have created these theories about vaccines that aren't true. But then there are other members on that panel that do have backgrounds that some people might say, okay, I accept what they have to say, but still a lot of questions remain. And I want to talk about the importance of vaccines because, Dr. Jain, as you know, I've been doing this whole TV thing for a long time, and I will never forget in 2000, being a newscaster and saying on the air that for the first time, the measles was declared eradicated, that it was gone. And now we're hearing stories about measles outbreaks. So what's going on? Why is it back?
You know, it's such an interesting situation we're in right now where, like you said, things like polio, measles, things that we don't have to deal with. I have 3 children. I am very happy that they are fully vaccinated because we are protecting them from these diseases. What's happened over the last several decades is we've seen a rise in misinformation. We've seen studies that have come out that aren't actually studies, but they're debunked opinion pieces. And we have people who are coming out and using social media, using their platforms, and talking about their opinions as if they are facts. And so it's confusing a lot of people. And because of that, as parents, we all want to just take care of our kids and do what's safe. But when you have people constantly shouting in your ear that science is not safe, that these evidence-based vaccines that have protected people and saved millions of lives are not safe, people start to question. And in science, we're all about questioning. We want to question. We want to study.
Ask you, what's wrong with looking at these again? I mean, there's nothing wrong with that, right?
There's absolutely nothing wrong with looking at things again, with doing studies, but they have to be scientifically backed. My opinion does not trump a scientific finding. Just because I say something doesn't mean it's true. We need clinical trials, we need studies, and these vaccines and these schedules have been vetted. They've been scientifically proven to be safe. And as you said, we were able to eradicate a very, very dangerous disease, measles, and we are seeing the numbers go up. We're seeing deaths go up because people are not vaccinating. So we're seeing the evidence now of what happens when people start to not trust science.
Okay, so we do have some viewer questions that we want you to hear. Here's one from Marcy in Chicago about herd immunity.
If kids aren't as vaccinated, should we be concerned about the loss of herd immunity?
That is a great question. And yes, if kids are not vaccinated, we should be worried about the loss of herd immunity.
Let's back up for a minute, because a lot of us became familiar with herd immunity during COVID-19. So explain what it is again, and then answer that question.
So herd immunity is a situation where the majority of people in a population have either been exposed to the virus or have been vaccinated against it. And different viruses have different levels that you need to achieve to get to herd immunity. So for example, measles, the goal is to get to 95% of people in a community either vaccinated or previously exposed.
Okay, so this is really interesting, and I was not aware of this, but Illinois provides a vaccine coverage map on the Department of Health website. I don't know if you guys at home are aware of this. This was new to me, but you can actually view student vaccination rates by zip code, by county, even down to the school itself. So as a parent, if you're home listening, you can go on this, you can zoom in on your school, you can zoom in on your zip code, your county, and it's going to tell you what the vaccination rate is. So as a parent who's watching tonight, is there advice that you might have for them? Is there a key threshold when it comes to vaccination percentages that we should be looking for?
So definitely this website is very helpful, and you should be looking for ideally above 95%, especially for measles. When it gets below 90%, that's when we get really concerned about people transmitting it and exposing others. And remember, you can get measles vaccines when you're younger, but there's certain people who are immunocompromised, patients who have cancer. They might have gotten the vaccine as a child or when they were younger, and they may no longer have that immunity. So again, if you're looking at the school numbers, look at anything above 95% is good. 90 to 95% is concerning. Below 90% is very concerning.
Well, the reality is if it's 90 or below as a parent and your child is in that school district, there's probably not much you can do. I can't imagine a lot of parents are going to pull their child out as a result. But if their child is vaccinated and they are in one of those low percentage areas, should they be concerned if their child is vaccinated?
So if your child is vaccinated and has gotten both of the MMR vaccines, has gotten all of the other vaccines, then you need to be less concerned, because even if they are exposed, the chance of them getting the virus or getting very sick is very low, which is why we recommend everybody get vaccinated.
Okay, so one of the things this new panel is doing, we talked about this, they are reevaluating the childhood vaccine schedule. Most of the childhood vaccines are recommended like in the first 18 months of life, right? Yep. So during that time, I counted, and you correct me if I'm wrong, there's about 12 to 15 shots up to 18 months of life. Okay, so again, is it worth looking to see if there's in fact too many? Because 18 months, you know, I'm a parent of 2 grown women now. I did all of the recommended vaccinations. I was nervous at the time. The MMR vaccine was a live virus, and I was nervous. Maybe I shouldn't do this because it's a live virus. What do you want parents to know about the number of shots that these babies are getting?
So I want to emphasize, I'm not only a physician, I'm also a parent. I have 3 kids, and when I took my first child to get her first vaccine, I had a little bit of a heart palpitation, and I thought, oh my gosh, is this the right thing to do? Because of all of this rhetoric that's out there. I will tell you confidently, this has been studied and studied and studied, and I would much rather that my children get lots of vaccines to prevent them from getting the actual virus that could potentially kill them. These vaccines can protect them and actually save their lives. So I will tell you, all 3 of my kids are fully vaccinated. They tell their friends to get vaccinated, and we get the flu shot every year. And we do this because as a physician, I have seen the complications of what happens if you get measles. I've treated people who end up very, very sick. I've seen pediatric patients who ended up needing spinal taps because there was a concern that they were having seizures. I mean, these are not mild illnesses. So I would much rather my children get a whole bunch of vaccines when they're young, so I know as a parent that I have protected them and prevented them from getting illnesses that could potentially either cause them death or cause them long-term medical complications.
It's interesting because there has been a resurgence of these measles parties where parents, children maybe have gotten measles, and other people are like, oh, I'm going to bring my child over so my child can be exposed. So then they will already have had it, and it's one less thing to worry about. This was something that was done back in the day, and it's back. What's your response to that?
I'm going to speak to every parent and child out there. Please do not take your child to a measles party. It is way safer for your child to get the measles vaccine than it is for them to get the measles illness. Remember, one is a vaccine. It's meant to prevent you from getting sick. The other is literally meant to get you sick. Measles will make you ill. The vaccine will prevent you from getting ill. So please do not go to a measles party. Please get your children vaccinated, not only to protect yourself, but to protect your grandmother who might be immunocompromised, to protect the kid in your class who might be undergoing chemotherapy. Do not take your child to a measles party. I will tell you the risk of that is way, 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 way higher than getting a vaccine.
Okay, so when we talk about reviewing the childhood vaccine schedule, the headline is to study the cumulative effect of all of this, right? So can you explain that and why this is such a top concern?
So people talk about this cumulative effect of, oh, you're getting so many vaccines, what the cumulative effect of all of these vaccines. So again, this has been studied and studied and studied by experts who don't have a dog in the race. They don't get paid extra whether the study comes out positive or negative. These are people doing the work because they care about science and about saving lives. The cumulative effect of these vaccines, I'll tell you what it is. It's life-saving. It is not cumulative effect that is dangerous. These vaccines are very, very safe. And so when we talk about this concern, it goes back to the same question of, are kids getting too many vaccines? It is absolutely categorically not true. The cumulative effect is actually preventative, and the fact that you're getting so many vaccines is going to protect you from all of those different illnesses.
When's the last time the schedule was actually changed, and how often does that happen?
So the schedule is usually changed about once a year, but research is being done throughout the year. And if there's updates or if we learn something new, then updates will come out throughout the year. But usually it's once a year. And again, I want to emphasize, because this is not like politics or opinions, this is science. As we learn more, we change recommendations.
Well, you know what's a perfect example? The HPV vaccine.
Yep.
We were told 2 doses when that first came out, and now they're talking about switching it to 1, right?
Yep, so there is a study that came out showing that 1 dose may be equally effective in preventing cervical cancer as the 2 doses. And if that becomes the guidelines, that'll be great, especially in areas where you may not have access to vaccines. Getting it twice might be more complicated. So if that is an updated guideline, I think a lot of people will be happy about it.
Okay, now we're going to talk COVID, which is where you and I really got to know each other.
Yeah.
When the COVID epidemic was here, Dr. Jane was on with us every morning talking about this. Things have changed because they have now given a few key updates to the COVID vaccine under Kennedy now. And one of the things is he no longer recommends it for pregnant women, and healthy children should not be getting the COVID vaccine. And a lot of people say, I'd rather have COVID now. It's not as bad as it used to be. Does this mean, as a result, that maybe insurance companies will not be covering this anymore?
That is a really, really big concern. And I want to, again, emphasize our goal is to keep healthy people healthy. So you want to keep healthy kids healthy. You want to keep healthy pregnant women healthy. How do you do that? You prevent them from getting an illness. You prevent them from getting COVID. So I would highly recommend that that is reconsidered, because again, studies have shown that the COVID vaccine is safe in kids. It's safe in pregnant women. So I think that we are reaching a point where there is concern that if insurance doesn't cover it, how are people going to access these vaccines? And again, vaccines are meant to prevent the illness. We don't want to get the illness.
Okay, so let's talk about the first vote by the new vaccine advisory panel. And that was that they recommended only thimerosal-free flu shots. They did recommend the flu vaccine, but they said without thimerosal, which is a preservative. And you were telling me that it's really not that big of a concern anymore, right?
So thimerosal was in a lot of the flu vaccines before, and this was looked at years ago, and it was found to not be a concern. There was no danger. It was very safe. But because of a bunch of people saying it was concerning, it was removed from the majority of the flu vaccines, which is fine. It doesn't help or hurt the actual vaccine. The purpose is to prevent, if you're using a vial where you need to take the vaccine out multiple times, you need to take multiple doses for different people, preventing infections. So the way this is really going to impact is those areas, those pharmacies where they're trying to get multiple flu shots out of one vial. Okay. And so it doesn't impact the majority of the country. But again, why are we talking about something that has been proven to not be a danger? There should not be a concern about these thimerosal in the vials because there's no danger to it.
It's not really a problem. Okay, they also recommended the new RSV shot, which I know you're happy about that.
Yes.
But what's interesting about all of this is their recommendations tied directly to funding and access. We were talking about insurance, but it's so much more than that. So who do you think would be affected by this no longer being a recommendation that comes from this advisory panel that then influences the FDA and so on?
And that's a huge concern. You hit the nail on the head. The challenge is communities where they can't have single vials. They're going to have access issues. There's so much confusion being sown right now that insurance companies aren't going to know what they should and shouldn't cover. Patients are going to get confused. Physicians are going to recommend you get a vaccine, and then you're going to show up, and the pharmacy's not going to know if your insurance will cover it. So what's happening is there's a lot of confusion being sown when we know these things are safe and effective, and this has been happening for years and years and years. So why are we changing everything based on people's opinions as opposed to putting this out in a methodical way, the way we should?
Okay, so when do we expect this advisory panel to meet again? And do you expect we are going to see some changes in the scheduling and other things?
So the American Academy of Pediatrics has said that they are going to keep coming out with their own guidelines. And
they're not going to follow the advisory panel.
So I think it's going to depend on what the advisory panel says. I think they have a lot of concerns based on what they've seen in the last couple of weeks, in the last couple of months. They have concerns on what the advisory panel is going to recommend. So for now, with the information we have, the American Academy of Pediatrics will continue putting out their recommendations. I don't know when this advisory panel is going to meet. It'll be interesting to see what they say. But my concern is we're going to be impacting negatively our most vulnerable populations, and we're just resulting in a lot of people being very confused. So I recommend people go to the AAP because that is a unbiased, non-political, driven by science and evidence guideline that I think I will at least be following moving forward.
Okay, so what do you want to say to parents who are watching right now about their concerns? Because obviously everybody wants our children to be safe and they want them to be healthy. What words do you want to leave them with?
So I'm going to speak to you as a physician, as a scientist, as a researcher, and as a parent to 3 young children. My kids are 11, 7, and 7. I will tell you that I would never put anything into my children's body that was not safe, effective, and was not the best thing for their health. So trust me, trust all of the doctors out there who are saying that these vaccines are safe. They have been vetted, they have been tested, they have had multiple trials, and us doctors and nurses and healthcare workers, we would not be giving our kids vaccines. We would not be taking them ourselves if we had any concerns. I was one of the first people who lined up for a COVID shot. My kids all have pictures that we have framed getting their first COVID shots. They are so proud of the fact that they are helping when it comes to public health, when they're helping prevent their friends from getting sick. So my plea to you as a parent, as a physician, is trust the science, trust the evidence. Don't let the misinformation impact your ability to protect your children. And vaccines really do protect your children.
Dr. Jane, as always, we appreciate your time. Thank you so much. And of course, this is a topic we are going to be keeping an eye on for you with what's going to be happening next. And we always want to hear from you. So you can email us at ask32@fox.com. Any medical questions, anything otherwise that you want to know about. And we're going to bring in the experts like we did this evening with Dr. Jane. Thanks again.
Thank you.